COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Bertemu kembali di Awani Pagi dengan perkembangan COVID-19 dalam dan luar negara. Kita lihat Amerika Syarikat kini berada di tempat pertama untuk kes positif COVID-19 dan juga angka kematian tertinggi. Kes positif sudah pun melebihi 500,000, manakala angka kematian adalah lebih 20,000. Ini yang paling tertinggi dan telah pun melepasi angka kematian di Itali sejak pagi ini. Dan untuk itu kita nak tahu bagaimana rakyat Malaysia berada di sana. Bersedia menerusi Skype Melinda Lee, pelajar jurusan farmasi di University of Michigan Ann Arbor. Thank you so much for joining us this morning, Melinda. Now, as I said, the numbers that we see reported from the United States are very, very alarming. And, you know, what we see is from the outside. But we want to know, what is the current situation on the ground where you are in Michigan?
Yeah, I mean, at my hospital, it's been very odd. A lot of the units have been switched over to COVID-19 ICU units. But we are seeing sort of a flattening of the curve a little bit. So it was really sharply rising. We were having 50 patients, then maybe the next day about 100, then 200, but now it's kind of staying stable around 200. So I think social distancing in the United States is definitely helping.
Yeah.
Melinda, did you receive any instruction or advice from our embassy there?
I only saw a lot of social media posts. There was a lot of social media posts on Facebook saying, you know, if you're in this area, email this email address. It wasn't very clear. So I definitely didn't get any direct correspondence. It was just a lot of social media posts, if that makes sense.
Melinda, are you at the hospital or are you just at home? What's your situation like right now?
Yeah, so I'm still completing my doctorate here, so I'm still attending classes online, and then I still go into the hospital to work. So I work as a pharmacy intern at the hospital. I work about, 20 plus hours a week. I'm actually going in tonight, later from 9 p.m. to 1 a.m. because we're very short-staffed.
Melinda, we see some reports of medical staff in the United States, mostly in New York, where they even staged a protest where they say they were not given any protective equipment, PPE, whilst they're working in the hospitals. Is that the situation where you are?
Fortunately, here at Michigan, our hospital has been very proactive, so they have procured a lot of PPE. So for me, when I go in, before I go in, I'm given one surgical mask for the full shift, but I get to throw it away. And during my next shift, I get to come in and pick up another mask. I know in other hospitals, that's not the case. They're being asked to save the mask that they're given. So we're fortunate that my hospital has had enough PPE for everybody.
Okay, Melinda, now we understand that you have a pharmaceutical background and you are working in the hospital. And you, I believe, also compare with how the crisis is managed in Malaysia. You must have seen some reports. So surely you have your own opinions about how the state is tackling this crisis. What is your take on it? Should it be taken more seriously? What is the political will like with the politicians there? What do you think?
What do I think? Obviously, they should have responded earlier, but I also think that hindsight is 20/20. It's always very easy to say, "Oh, we should have done this instead." I really can't give a good opinion on like how much earlier we should have started social distancing. Probably much earlier, but I can't tell you exactly how much. Should we have gotten as early as Malaysia? Because I know Malaysia was very, very proactive with the mask and with hand sanitizing. A lot of people here were not taking it seriously. But for now, I think we are doing pretty well. I think that there's a lot of collaboration within the medical community. And, one of the benefits of social distancing is not just flattening the curve to prevent healthcare systems from being overpacked, but also giving time to the doctors and nurses to figure out what works, because they're figuring out on the fly. If you got COVID-19 3 weeks ago, the treatment that you would have received then is going to be quite different from what you receive now because of what they've learned within this past 3 weeks. So I think it's good now that we've had some time. We've kind of helped flatten the curve a little bit, and it's given more time for all the doctors to collaborate, publish, share information with each other in order to improve the way that they're treating these patients.
Melinda, we've seen some report that saying that 16 million US citizens that are affected, job loss, about 16 million there.
Yeah.
Is there any Malaysian citizens that are also affected by the report?
I'm sure there are. I have, most of my friends are students, so the impact that's been on them has been that they had to go home, not attend graduation, things like that. But there are definitely people that's been impacted by it. Very close friends of mine that have lost their jobs, if not, have had their pay cuts quite significantly. And I know a lot of people say like, oh, healthcare is safe. If you're in healthcare, you're safe. But that's not the case across the United States. Individuals who are in smaller hospitals that are not able to take COVID-19 patients, nurses, pharmacists in those places are getting furloughed. They're being asked not to come in, and they're not being paid in those areas.
Now, Melinda, is there a need for Malaysians in the US to return home at this point? Because we see a lot of Malaysians, particularly students in Europe, they're coming back by swaths. So is there that need in the US as well?
I think to each their own. I really can't comment on, should all Malaysians go home now? I think given the risk of catching the disease, not just spreading it back to Malaysia, but given the risk of you picking it up from international airports, I think it's much safer now to just stay put. Yeah. But I can also understand why people would want to go back. It's a very terrifying time, and being socially isolated here can be difficult. For me, I tried getting groceries yesterday and it was impossible. I tried going to several grocery stores. The lines were just so long because they needed everybody to be 6 feet apart, and there was a minimum number. So, I can understand why people want to go home. Yeah. But I can only understand the reasons to stay as well.
All right, thank you so much, Melinda, and we wish you all the best, and we hope you stay safe
there.
Thank
you so much.
And as well as all the other Malaysian students in the US. Baik, terima kasih kepada Melinda Lee, pelajar jurusan farmasi University of Michigan untuk perkongsian itu. Banyak lagi laporannya ada di Astro